Hi and welcome. We're going to be talking about the principles and practical applications of big data and big data set in the healthcare industry. Um, we are going to have an overview of big data in the healthcare industry. We will delve into some of the ways in which big data has been applied um, within healthcare, and we will look at some of the different data types or different data structures that exist within this industry. And we're also going to look at some of the principles that are applied to maximize the value of big data in healthcare. The healthcare industry has increased exponentially and is estimated to be worth 665.37 billion by 2028. Now, the increase in human lifespan due to improvement in healthcare technologies has resulted in an increase in the number of hospitals, clinics, and healthcare systems across the world. Now, the healthcare industry actually started with home remedies. So humans were able to use plants to treat diseases. And the practice was documented and now passed to the next generation. It was until the 20th century where we now had the therapeutic revolution, and which was characterized by the development of medicines for peculiar diseases. The growth of the healthcare industry also sparked the generation of big data. So big data is continuously generated across different sectors within the healthcare industry, and it includes structured, semi-structured, and unstructured data. Previously, the hardware capacity only supported the storage, the analysis, and the management of structured data, which was mostly stored in relational database management system. But current advancement in technologies has helped us. We now have the hardware and the software technologies that have created opportunities to store, manage, and analyze semi-structured and unstructured data. So the big data that is created within the healthcare industry has offered incredible value to the industry and has now been used to improve healthcare delivery through multiple facets. So the objective of this talk was to discuss the utilization of big data in the healthcare industry and the different data types of the big data and some of the technologies that are employed to maximize the value of big data within the healthcare industry. So let's look at some of the ways in which big data has been used to improve the healthcare industry. So it's been used for the prediction of patient admission to match the patient admission. So big data of patient admission record of previous years could be used to train a predictive machine learning model, and the model can now be used to predict the daily, the monthly, the yearly patient admission in clinics or hospitals. And this is going to save cost time because only the required number of staff will be put on duty to match the expected patients. So unnecessary human resources will be avoided. It has also been used for preventive care and real-time alerts. So big data that is collected from patients about their identity, their behavioral habits, the warning signs such as blood pressure, temperature, heartbeat, using smart wearables can now be used by doctors to determine a patient's chances of developing a particular disease and alert the patient in real time. So the illness can be treated at an early stage than when it becomes serious. So big data has also been used for the treatment of cancer and other difficult diseases. AIDS, cancer, and multiple sclerosis, and others are some of the most difficult diseases to treat. Big data that is collected from patients about separate treatment plans that have been employed for several years could be analyzed, and the treatment plans will be analyzed to identify insight, trends, and patterns in order to identify the plan with the highest success rates. It has also been used for medical imaging through trained deep learning and machine learning models. So clinical image data such as data from CT scans, MRI, PETs, and other medical imaging techniques are a rich reservoir of historical uh, image big data. So radiologists will often spend hours to analyze a medical image during diagnosis. But nowadays, we can use convolutional neural network um, or other machine learning models to train a model using this historical image to assist doctors or radiologists with the diagnosis. So the model will have the capability to convert image pixels and trends into numbers, which can be easily interpreted by doctors and also assist them with the diagnosis. Electronic health records, electronic health records have also been used in the healthcare industry. So one of the biggest source of big data in healthcare is in the electronic health records. It's from the electronic health records. Um, Electronic health records have been widely adopted in the West, especially in the US and in Europe. So the big data from the electronic health records provides a complete picture of a patient's medical history. So the big data in the electronic health record can be used to activate alerts and reminders to a patient about the next lab test, or uh, the big data from the electronic health record can also be used to track a patient's prescription to see if they're actually following the doctor's order. And the data can be shared securely between the public and the private sector. So let's examine other ways in which big data has been used to improve the healthcare industry. So it's been used for smart decision making and strategic planning. So insight trends from the analysis of big data in healthcare enable doctors, nurses, and other healthcare specialists to quickly identify problems and opportunities. For instance, the analysis could reveal areas within a community which are suffering the most, and such that care units could be redeployed to these areas. It has also been used for the development of new drugs and therapies. So, predictive analytics and data visualization methods could be applied on historical and real-time healthcare big data. So, the analysis could easily spot prospective weaknesses and strengths in the trials and processes, and this could eventually lead to the development of new drugs or new therapies. It's also been used for medical decision support. So, in hospitals and clinics, um, a medical software such as clinical decision support software is going to analyze medical big data in seconds, and so provide doctors, nurses, and other healthcare specialists with appropriate advice as they make prescription decisions. It's also been used to increase patient engagements for their own health. So human generally have a huge interest in smart devices nowadays, such as smartwatches and other wearables. So these devices could record a patient's heartbeat, the blood pressure, the temperature, sleeping habit, and this can be done continuously. So the information could be integrated with trackable software to spot um, potential health risks in the patients. For instance, um, chronic insomnia and increase in heartbeat could signal a potential heart disease, a potential heart disease. So the patients are now directly involved in the monitoring of their own health. Um, it's also been used for public health monitoring. So, available big data analytic tools have been used to analyze big data from infectious diseases to be able to predict potential outbreaks and the spread. So, the big data from the infectious diseases is analyzed to provide up to date statistics and now track the spread and also predict the impact of subsequent outbreaks. Um, for instance, coronavirus data is currently collected by many countries across the globe to be able to improve um, the epidemic surveillance and also how they respond to it. So big data has also been used in telemedicine. So big data is used in robot assisted surgery. So with the aid of robots and high speed real time data, doctors could perform surgery in areas in which they are not physically present. And big data has also been used for initial diagnosis, for instance, to or for remote patient monitoring and also for virtual nursing assistance. It's also been used to monitor suicide. So big data that is extracted from electronic health records about the patients or persons as combined with data analytics tools could be used now to predict and accurately identify persons or patients with a high risk of committing suicide. So let's examine some of the different data types and structures that are generated within the healthcare industry. Um, it could include personal information such as the patient's name, the address, telephone number, email address, and this kind of data is structured and it comes from electronic health records and it's often organized. Uh, we also have personal health records, and this kind of data includes the patient's health information like the illness, hospitalization, chronic diseases, um, drug reactions, allergies, lab test results, prescription records, surgeries, vaccinations, and that kind of data. And this kind of data is unstructured and it often comes from hospital information system and it's unorganized. We also have the medical images, which comes from or which includes MRI, X-ray, CT scans, radiography, echography, ultrasonography, and other medical imaging techniques. And this kind of data is unstructured, and it often comes from radiology information systems, and it's unorganized. We also have the vital sign kind of data, which includes like the temperature, blood pressure, respiratory rates, the pulse, and other physiological health data. And this kind of data is structured and it often comes from physical examination systems or also from electronic health records. And this kind of data is organized. We also have the electrocardiogram. Uh, it includes electric graph writing down the heartbeat of patients within a minute. And this kind of data is unstructured and it often comes from radiology information systems and it's unorganized. We also have genomic data. Uh, it includes genomic and RNA sequence data, um, nuclear magnetic resonance, and also data from mass spectrometry. It's often unorganized and comes from laboratory information system and it's unorganized. So let's examine some of the machine learning and deep learning models that have been applied to maximize the value of big data in healthcare. So several tools including machine learning and deep learning models have been used to extract value from big data. Machine learning models are generally based on algorithms developed to cause computers to learn from data and resolve human-like problems, and it's divided into supervised learning, unsupervised learning, and reinforcement learning. So why deep learning models such as artificial neural network, convolutional neural network, and recurrent neural network functions like the human brain to learn and process data, and the models can identify images, objects, which could now be used to enhance drug discovery and precision medicine. The Hadoop ecosystem and tools have also been applied for the management of unstructured big data, and this data could include doctors' notes, text, or lab tests. Um, One area in which these models have been applied in is in radiology, and radiology is a very important component in every hospital, clinic, or healthcare system. Their role in cancer and image-related diagnosis and treatment cannot be overemphasized, and the models have been applied in the following ways. Um, the models have been applied to revolutionize cancer diagnosis. So, breast cancer diagnostic images that were previously labeled by an experienced cancer pathologist uh, were used to train a machine learning model, and this model have been able to distinguish between benign and malignant breast cancer with incredible ability. The models have also been applied in like a skin vision, like in the skin vision algorithm. Um, so big data was actually used to build um, a skin vision mobile app called Skin Vision, and it's an algorithm based on a smartphone application which enables a user to self-check skin cancer just by uploading um, a photo to the application using their phone, and it has the potential to reveal the color, the texture, the shape of the skin lesion just as a doctor will do. And and you could now get these self-check results could be obtained within like 30 seconds, and you could get about 95% success rate. The models have also been applied in MRI medical imaging. So uh, in a situation where there's one situation where several weighted MRI images were used to train a convolutional neural network, which was now used to improve abdominal organ segmentation of the right kidney, the left kidney, the liver, the stomach, and different organs within the body. The models have also been applied in renal transplant acceptance or rejection. So, um, in renal transplants, big data was used to train a deep learning based classifier that was stacked with non-negative constraint autoencoder to differentiate between non-rejected and rejected renal transplants in like in diffusion weighted imaging recordings. Uh, the diffusion weighted imaging is a method that is used to evaluate the molecular function and the microarchitecture of a human body. Big data. So the Hadoop ecosystem and tools have facilitated the management of unstructured big data, such as doctor's notes, uh, texts, or lab tests. So the Hadoop ecosystem has been applied for cancer treatment and genomics. So the human DNA is known to contain about 3 billion gene pairs, and cancer mutations and reactions are based on each patient's genetics. So experts have advised that specific treatments should be provided to specific cancer types. So the Hadoop map reduce technology has been used to enhance the mapping of 3 billion DNA base pairs to decide an appropriate cancer treatment for a specific patient. It's also been applied for vital signs monitoring. So huge amount of data is generated from hospitals' sensors. So the sensors collect huge unstructured data such as blood pressure, heartbeat per minute, blood sugar level, respiratory rates, and etc. So the Hadoop distributed file system, including HBase and Hive, have been used to convert this huge unstructured data to improve healthcare delivery. And this has been very helpful, especially in ICUs, to automatically alert medical professionals in case there are some variations or issues with values that are coming from the hospital sensors. It has also been applied to connect hospital systems. So most hospital systems are networked, and there are a big data source ranging from patients care, finance, payroll, and staff. So the Hadoop NoSQL database technology facilitates the collection and management of real-time big data, and that is originating, of course, from these sources. And this helps to identify high-risk patients and also reduce the daily cost. It has also been applied in healthcare intelligence. Hadoop ecosystem, insurance companies have been able to use prediction applications to identify patients who commit frauds by using their data regarding previous health claims and voice recordings, wages, and their demographics. So here are references for the literature that was reviewed. And thank you for your kind attention.